Seasonal flu almost disappeared from Australia when the COVID-19 pandemic hit. Now, not only is it back with a vengeance, but the annual flu season appears to be starting and peaking earlier these days than it used to. The good news is there's now a different cell-based flu vaccine available that experts hope will be more effective than the mostly egg-based vaccines that used to be relied upon before. We're to discuss this and other flu threats. I'm joined by Dr. Norman Swan from RN's Health Report. Hi there, Norman.
Hi, Ross.
So why is the flu season starting or peaking earlier?
Nobody knows the answer to that question. It could be climate change. Seasonal viruses are affected by the seasons, and seasons are moving around with climate change. So we're not alone. It's happening in the Northern Hemisphere as well, that flu is emerging earlier, and it was happening before COVID. People forget that January 2020 was a bad flu month, and that was very early. And the year before was early as well. So it seems to be a pattern that's developing internationally, and may well because of temperature, who knows what.
So what's this new cell-based vaccine that's available this year?
Well, it's one of many. So the first thing I'll say is that the standard vaccines are made on egg. By the way, does not mean you cannot, people say, oh, I can't have it because I'm allergic to egg. It's actually not grown on egg. It's grown on chicken embryos, which are part of the egg. And so you can have it if you're egg allergic. There is a bit of a problem with egg-based vaccines in that your immune response to the flu virus vaccine diminishes a little year by year because of a complicated interaction with the egg protein. It's thought that these cell vaccines may avoid that. Now, if all that's available when you go for your flu vaccination is an egg-based vaccine, it's perfectly fine. It's just a little bit better with the cell-based. And some people internationally are saying maybe when kids get their first flu vaccine, it should be a cell-based vaccine so they don't get into this problem with the egg vaccines. It's not an allergy. It's just simply a slight diminution of the allergic response each year. But there are more vaccines available this year than before. And remember, people over 65 get a higher dose vaccine, which gives them a stronger immune response. And the interesting thing is, which is really just a sideshow, but it's worth noting, is that they're quadrivalent vaccines, which means there's 4 versions of the flu virus in it. And it's not that different from the vaccine that they had in the Northern Hemisphere their winter. But the fourth virus that's in it is actually extinct. It's called Yamagata. It hasn't been around since 2020. The Americans got it in their vaccine. We've got it in ours. Next year, we'll be back to 3 versions, almost certainly, of the flu virus in the vaccine without the extinct one. Not going to do you any harm, and should it come back from extinction, you're protected.
Yeah. Also reports, Norman, about another more dangerous type of flu that's around, avian flu. What's the story there?
It's been around for a while. It's called H5N1 and started off in wild bird populations, then moved into poultry flocks, and there's massive culling of poultry flocks around the world over the years. Then it's moved into other wild birds like penguins. But then a little while ago, it did mutate and enable it to get into mammals. So from birds into mammals, like mink and so on. And that was a worry because we're mammals too. Could it infect us directly? Now, luckily, so far, there's no evidence of that. But last week, over the last little while, it's got into the dairy herds, some dairy herds in the United States, H5N1, and there's been one case of somebody infected from an infected cow. Now, the mortality rate of H5N1 is 40 or 50%. And so it's a nasty virus if you catch it. The thing that's good at the moment is that it has not mutated so that it easily passes from human to human, which is what holds it back from becoming a pandemic. But it's being watched closely.
More on the Health Report on RN and on the What's That Rash podcast.
Thank you.
Thanks, Norman.